Where is Singapore at on the vaccine front, and how will it be prioritising who gets the vaccine first?
Hi, Juliet. We have been monitoring the development of vaccines very closely, and we are quite confident that there will be a few promising candidates that will meet the cut, and these vaccines will be available as soon as sometime next year. So we are entering into supply agreements with several vaccine companies, and this is on top of what we will be getting through our participation in the global COVAX facility. And so if and when vaccines are approved by regulators around the world, we will make sure that they are available for use in Singapore as well.
And just to my other point, who will get the vaccine first?
Well, we have set up a scientific committee to help us prioritize. We do expect the vaccines to come in batches, so not everyone will have access to them right away. And we have put in place a process to help us prioritize who should get them first. We think, for example, it should be the medical personnel, the frontline workers, the critical frontline workers, vulnerable groups, including the elderly and those with underlying health problems. That's our initial sense, but the scientific expert committee will help us put up the recommendations.
BlackRock's Larry Fink was saying there is global fatigue about living with COVID-19. Here in Singapore, the restrictions have been very strict. We've been living with wearing masks for a long time. When do we get to phase 3?
Everyone has been asking me this question. We will get into phase 3 at some point in time. It could be the end of the year. It could be early next year. But when the conditions are right, we will let everyone know when we will be in phase 3. But the key thing is this. Phase 3 is not a free-for-all. Phase 3 is not going back to the pre-COVID status quo ante. And we will be in phase 3 for quite a while, because phase 3 will last until an effective vaccine or treatment is widely available. And so even though we expect early deliveries of some of these vaccines coming into the market, the distribution of vaccines to everyone, I think, will take some time. So we may very well be in phase 3 for a year or longer, which means that we really need to stay vigilant and disciplined and continue to cooperate with all the prevailing measures, including wearing of masks. And basic, simple rules and precautions like avoiding large crowds. I think we have, it's easy to get carried away with the vaccines, and it's wonderful news. We look forward to them, but let's not sniff at the small stuff. The basic, simple precautions do work, and we should all continue with them.
Minister, what is phase 3 exactly for people here in Hong Kong? We don't know what that means, and elsewhere probably too. And, will a normal after COVID also require restrictions in case of a reappearance of a different pathogen?
Well, thanks for the question, Richard. We embarked on a 3-phase reopening plan after the circuit breaker, which was our lockdown in May. So we are in phase 2 now. Phase 3 at some point, maybe later on. Phase 3 simply means we will be able to meet in a slightly larger group of 8 persons. And, there will still be a need to wear masks. There will still be a need to contain large gatherings. So we think in terms of crowd sizes, we could have multiple groups of 5. But at the same time, we want to see more testing in place, and we want to ensure everyone, as many people as possible within the population, participates in our Trace Together program. That's our contact tracing program, which enables us to very quickly identify close contacts and contain any clusters from breaking out. So that's largely what phase 3 will be. And we, like I said, expect phase 3 to last for quite some time until a vaccine or a treatment is widely available.
Minister, we've talked about travel bubbles. Of course, there's one starting off in just a few days between Hong Kong and Singapore, but there's also people been touting an ASEAN travel bubble. Is that feasible given the unevenness of the disease and its penetration in those different countries?
The key idea about a travel bubble is to identify countries with similarly low levels of incidence. And when there's confidence between these two parties about the prevailing rates of infection and the control measures we are in place, then the two countries or more can come together, open up, and allow for free travel without any quarantine, but just subject to a pre-departure test. So that's the arrangement that we have in place with Hong Kong. We welcome other countries to join the bubble, and we hope that what we are doing with Hong Kong can set the example for more travel bubbles to form elsewhere in the region, including with ASEAN. But the key is that the countries must meet the conditions. Travel bubbles will only be formed amongst countries where there is a low level of incidence and control measures are in place.
Minister, we're all hoping this travel bubble with Hong Kong goes well and, as you say, paves the way for further ones. But what happens if we see a spike in unlinked cases in either Singapore or Hong Kong?
Well, we have discussed these contingency plans with our Hong Kong counterparts. There are various things we can do. We can slow things down in terms of the number of travelers in order to reduce the risk. And if the number of unlinked cases rise to beyond a certain threshold, we could temporarily suspend the travel bubble. So these plans are in place already.
All right, and what about some of the other thoughts of, travel, cruises to nowhere, that sort of thing, to try and get the economy kicking along?
Well, we have started these as well. So again, the basic posture Singapore is taking is that we want to open up, because this is existential. There are some countries which are, like Singapore, they have succeeded in keeping the infection rates low, but they are keeping their border measures quite tight. And they can afford to, because these are large economies with sufficient domestic demand. Singapore does not have that luxury. We cannot afford to live in splendid isolation from the rest of the world because we are so small, and we have to plug into the world, not just for the economy, but even for our social and community needs. So we are looking at ways to open up gradually, and that would include cruises, which we have started, subject to very strict protocols, including testing, safe social distancing measures on the cruise ships. These have started, and so far they have proceeded well. So we will continue with this approach. We are open for business, but we just want to make sure that sufficient safeguards are in place to allow us to open up safely.
Minister, very quickly here, one of the things the pandemic in Singapore highlighted was the plight of migrant workers. What are you doing to address some of the awful conditions they live in, which essentially allowed the coronavirus to breed and to spread?
We have put in place plans already, and these are underway. We've talked about building additional dormitories with different sets of conditions. And even within the existing dormitories, we have reduced the number of workers in a room. We have ensured new safety measures. The point is that in any setting, it doesn't have to be a migrant worker dormitory. It could be a student hostel. It could be a cruise ship. But in any setting where there is communal living and there is close proximity amongst people, we have now learned that it is very easy for the virus to spread quickly. And that's why in all of these settings, whether it's a migrant worker dormitory, whether it's a cruise ship, whether it's student hostels, we are putting in place new precautions, and these are working up to now so far.